Hello everyone, my name is Ife Facina and I will be providing you with the pharmacy updates from July. In this presentation, we will discuss 3 new FDA approvals, a new dosage form of glucagon, new indications for 2 medications, a prescription product now over the counter, and updates in the 2020 ATS guidelines for tobacco cessation. First, we will discuss the new FDA approvals. Byfavo is a rapid-acting intravenous benzodiazepine indicated for use in short-term procedures. Compared to midazolam, Byfavo, also known as remimazolam, has a faster peak effect, shorter duration of action, and shorter half-life elimination. Propofol is also commonly used at Moses Cone for short-term procedures due to its short duration of action at about 5 minutes. However, elimination tends to be longer at 40 minutes to a few hours. This active comparator trial compared Byfavo versus midazolam versus placebo during a colonoscopy. The results showed that Byfavo was more effective than midazolam and placebo for short-term procedures. Rukobia is meant to be used in combination with other antiretrovirals to treat resistant HIV-1. Rukobia has a unique mechanism of action where the active form of this drug selectively inhibits the interaction between the virus and cellular CD4 receptors. Xywav is an oral solution indicated in people greater than 7 years old with cataplexy and excessive daytime sleepiness and have been diagnosed with narcolepsy. The mechanism of action is unknown, but it's hypothesized that therapeutic effects are mediated through GABA B receptors. The active ingredient is a form of GHB, so this medication will be monitored closely through the REMS program. A clinical pearl is that Xywav has 92% less sodium than sodium oxybate, which is another treatment option for narcolepsy. Targets GABA B, noradrenergic, and dopamine receptors, similar to other treatments for narcolepsy. Got approved through a phase 3 trial for efficacy and safety. This study showed that patients had on average less cataplexy attacks compared to placebo with statistical significance. Another phase 3 trial was conducted parallel, but with children ages 7 to 17. Results were also statistically significant with on average less cataplexy attacks compared to placebo. However, a higher percentage of children experience adverse reactions compared to adults. Next, we will discuss a new dosage form. Gvoke is a glucagon prefilled autoinjector pen that has been approved for severe hypoglycemia. This is available in 2 different doses based on weight. Now we will discuss medications approved for new indications. Qutenza is a capsaicin patch newly indicated for pain associated with diabetic peripheral neuropathy. Application is recommended to be done by a healthcare professional. Tremfya has a new indication for active psoriatic arthritis. The approval of this medication was based on the DISCOVER-1 and DISCOVER-2 trial. Tremfya, also known as guselkumab, inhibits the p19 subunit on interleukin-23 to decrease inflammation. The DISCOVER-1 trial used the ACR20 scoring system after 24 weeks to see how effective Tremfya was for psoriatic arthritis. The data showed statistical significance, allowing for FDA to approve for this new indication. This chart shows that patients responded best to the Tremfya regimen of 100 milligrams every 4 weeks compared to 100 milligrams at week 0, 4, then every 8 weeks, or compared to placebo. Now we can discuss a product that has been moved from prescription to over-the-counter. Pataday is now an over-the-counter medication indicated for signs and symptoms of allergic conjunctivitis. Pataday is a competitive option for allergic conjunctivitis compared to other eye drops. Although it is more expensive, the duration of action is longer. Finally, we can discuss an update in the American Thoracic Society guidelines on tobacco cessation. The ATS guidelines support the use of varenicline over other products for tobacco cessation, such as the nicotine patch, e-cigarettes, and bupropion. The studies also show that varenicline had fewer adverse events than the nicotine patch and the e-cigarettes, but it's still comparable on adverse effects with bupropion. The combination of varenicline with the nicotine patch was shown to be more effective than either treatment alone. E-cigarettes do have a higher risk of continuation, and it is harder for patients to break their addiction, which is why varenicline is still preferred. Varenicline is also beneficial in patients with psychiatric comorbidities. Studies also show that it's okay to administer varenicline even if the person is not ready to abstain from smoking. It is also recommended to use varenicline treatment for at least 12 weeks for greater benefit. In summary, Bifavo is a rapid-acting benzodiazepine that can be used for short-term procedures. Rukobia is a novel medication indicated for treatment-resistant HIV-1 when used in combination with other antiretrovirals. Xywav is a competitive treatment option for pediatrics and adults who have narcolepsy with cataplexy. Gvoke is a glucagon autoinjector pen for severe hypoglycemia. Tremfya has been approved for a new indication of active psoriatic arthritis. Qutenza has a new indication to help with painful diabetic neuropathy. Pataday is now available over the counter for allergic conjunctivitis. The new ATS guidelines recommend varenicline as the best option for tobacco cessation. Thank you.